All right, first we'll start with hypothyroidism. In this lesson, we're going to discuss hypothyroidism, a condition in which the body does not produce enough thyroid hormone. The pathogenesis of hypothyroidism is characterized as primary, secondary, and acute/subacute thyroiditis. Primary hypothyroidism may be caused by iodine deficiency, congenital defects, treatment of hypothyroidism, or an autoimmune disorder called Hashimoto's thyroiditis.
Secondary hypothyroidism is caused by insufficient stimulation from the pituitary or hypothalamus and peripheral resistance to thyroid hormones. Acute thyroiditis refers to an acute bacterial infection of the thyroid tissue. Subacute thyroiditis refers to the non-bacterial inflammation of the thyroid preceded by a viral infection.
Predisposing factors for hypothyroidism include iodine deficiency, women over the age of 40, coexisting autoimmune disorders, a recent acute bacterial or viral infection, treatment with radioactive iodine, a thyroidectomy, exposure to external radiation, pituitary or hypothalamic disease, the postpartum period, type 1 diabetes, chromosome disorders, celiac disease, and side effects of medications.
Early symptoms of hypothyroidism include weight gain, fatigue, cold intolerance, constipation, dry and flaky skin, coarse hair or hair loss, impaired memory and concentration, periorbital edema and facial puffiness, irregular or heavy menses and infertility, delayed reflexes, elevated blood pressure, hyperlipidemia, and jaundice.
Late onset symptoms may include myxedema, enlarged tongue, hearing loss, bradycardia, cardiac hypertrophy, pleural effusion, ascites, pituitary or hypothalamic failure, loss of axillary and pubic hair, amenorrhea, postural hypotension, exercise intolerance, carpal tunnel syndrome, depression, and ataxia.
Pediatric patients may present with symptoms of short stature, delayed skeletal maturation, overweight, delayed puberty, sexual precocity, breast development in females, and genital malformation in males. The diagnostic workup includes a TSH, T4, T3, thyroid antibodies, CBC, lipid profile, and thyroid ultrasound.
Pharmaceutical treatment options include initiating levothyroxine or desiccated thyroid and adjusting dosing based on a surveillance of the patient's thyroid panel. Other treatment options are dependent on the cause and may warrant referral to an endocrinologist, especially in the case of surgery for an enlarged thyroid and treatment of malignant thyroid nodules.
Yeah, and there you have it. You are now ready to treat the patient with hypothyroidism.